Hi. At this moment, I'll talk a little on safety nets for the new nurse. What am I talking about? Safety nets. As a new nurse, regardless of where you are from, regardless of how prepared you might have thought you were, there comes a time you become fearful, anxious, anxious for many reasons. Anxious or fearful because you don't want to make any mistakes. You don't want to, you're scared of speaking up, of approaching the doctors, or not feeling that you know enough. But I want to remind you this time that efficiency comes with experience and time. So encourage yourself. You have to advocate for your patients. And that's so, so important. Advocating for your patients is critical. You need to ensure that you are not going to be 100% uh, knowing it all at first. And no one knows it all. That's why we have teamwork. And so I'm encouraging you to ensure that when you feel fearful, think of the protocols, the resources that you have, the protocols, the teamwork, and of course, asking questions. That's so important. Those characteristics, those will help you along your nursing journey to make you feel more confident as you grow. So, I just want to remind you today that fear is real. And no matter where you're from, and no matter how prepared you are, that moment will come. And if the truth be told, you will hear from other nurses who have gone on before you that their first time was they also experienced some form of fear roller coaster. So I'm just encouraging you today. I'm actually out in nature and I thought of doing this. I followed my daughter, who is in the Westport area, promoting her program, her STEM program, that's science for her science engineering, technology engineering, and math for her from her student, young ones, and she's going to be having in this area. She has gone to different areas, different countries, and now she's in this area, another state in Connecticut. She's been in Philadelphia, she's been in New York, and she's doing just great. So we're just encouraging her as she has this dream that she will be successful. So I'm just going to say thanks for listening, and my new nurses, congratulations on your success. Congratulations, and keep going. Now, I would like you to subscribe. Where? YouTube, Miriam Amanda Smith, and share it with others. And there are topics definitely that I'm talking about, we can discuss. But I want to remind you that soon and very soon, all right, soon and very soon, I'll be coming up with a small EKG book. I taught that for a while, and I know the fears of that. But as one transitions into another area of nursing, especially in the cardiac or emergency or step down or any of those areas where patients are being monitored, GI, labor and delivery, yes. Sometimes the rhythm can be a little challenging, but as you practice them, of course, that too will become easy for you. So, that will be coming up very soon. I look forward to seeing you and hearing from you. But just remember that there are help out there for you. Get a mentor. Get a mentor. Yes, get a mentor. It doesn't have to be in the same area or institution that you work in. and also your protocols. Check your protocols, teamwork, connect with other nurses, and of course, ask questions. Those will help you to to feel more confident and also to grow in this noble profession. Thanks for listening. Connect with me on YouTube. That's Miriam Amanda Smith. On Instagram, that's what? What is that on Instagram? That is Podcast Mir. And of course, Facebook and on podcast is Empowering New Nurses. Now you can get your book that I've worked on hard for my nurses. And here it is. You might have seen it before, but it's Nurse, the guide to empowering new nurses in the delivery of high quality care to all patients. And that's deliberate to all patients. So I look forward to hearing from you, and you can choose to write something in the comment. Yes, if you have been blessed, if you have been inspired, if you have gained some information that can help you personally as a nurse, or anyone else who have been impacted by what I've said, put it in the comment. I appreciate you. Be blessed. Bye bye.